Hi everyone, my name is Natalia Garcia Moreno, and I'm a junior psychology student at Union College. My research is titled Fat Phobia, Lack of Training, and Their Effects on Misdiagnosis of Eating Disorders. Weight stigma has been defined as the social rejection towards people who do not fit the social norm regarding weight and body shape. This weight stigma is severe. Research has shown that overweight children are less likely to have friends. Overweight adults have lower incomes and are less likely to receive support from teachers and parents to attend college. Weight stigma is justified under the false belief that people are overweight because they have low levels of willpower. Weight stigma is also prevalent among healthcare professionals, such that research has shown that overweight individuals with similar eating disorder symptoms than underweight individuals were less likely to be diagnosed with an eating disorder and were also less likely to receive inpatient medical treatment. Research examining level of training among healthcare professionals has found that healthcare professionals are often not trained enough to diagnose and treat eating disorders. Further research has looked at the relationship between weight stigma and eating disorder diagnoses with a sample of graduate students in mental health programs. For our current study, we wanted to examine how fat phobia and weight impact eating disorder diagnoses and confidence among a typical sample and a sample of medical professionals. We hypothesized that people would be less likely to diagnose obese individuals with an eating disorder and that they would feel less confident in their diagnoses in comparison to underweight individuals. This would be especially true for participants higher in weight stigma. For our typical sample, we recruited participants via cloud research. And for our medical professional sample, we recruited professionals via LinkedIn and healthcare professionals' Facebook groups. For our materials, we used the fat phobia scale to measure weight stigma, the clinical vignettes to measure accuracy of diagnoses, and the post-vignette questions to also measure accuracy as well as confidence of diagnoses. Lastly, we presented participants with a training questionnaire in order to measure level of training for eating disorder diagnoses. Our materials were randomized, and the fat phobia scale was counterbalanced with the rest of the survey. For both our typical sample and our sample of medical professionals, we found that participants were more likely to diagnose underweight individuals than obese individuals with an eating disorder. People higher in weight stigma were more likely to accurately diagnose patients with an eating disorder. Further, participants were more confident with their eating disorder diagnoses if the patient was underweight, in both the underweight and obese condition. We are currently still conducting data and hope to have the results regarding level of training in the near future. Future research may present participants with vignettes of patients that don't have an eating disorder in order to see whether participants would overdiagnose patients with an eating disorder and underdiagnose patients that are obese. If this was the case, it would suggest that they're not actually accurately diagnosing patients, but rather diagnosing them based on their own levels of weight stigma and anti-fat biases. I would like to thank the student research trend at Union College, as well as my advisors, Dr. Connor O'Day and Dr. Catherine Walker. If you have any questions, please feel free to reach out to one of my advisors at odaysc@union.edu. Thank you for listening to my presentation.